Hello, and welcome to an Introduction to Telehealth lecture, How Technologies Are Transforming Healthcare. What is telehealth care? Telemedicine is the use of technologies to remotely diagnose, monitor, and treat patients. Telemedicine is provided by healthcare providers. Telehealth, largely, is the application of technologies to help patients manage their own illnesses through improved self-care and access to education and support systems. Telemental health, specifically, is a subset then of telehealth care that uses technology specifically to provide mental health care services. Social work practices telemental health. When we envision telehealth practice, therefore, we probably imagine a telehealth care provider, like a nurse, a physician, a technician, a psychiatrist, or even a behavioral health care specialist, practicing from his or her office, perhaps in a hospital or an outpatient clinic. The patient then is able to access this provider from the comfort of their own home, using, for example, video teleconferencing to communicate in real time with the provider. This allows the patient to access healthcare without the burden of leaving the house. For patients who are possibly homebound or those with mobility issues, this opens the door to healthcare that may not have been previously available. When we look at telehealth versus in-person services, there are some differences. With remote services, a physical examination is not required or possible. Assessment is done through visual observation, detailed interviewing, and even with wearable technologies. For example, a patient may need his or her blood pressure monitored regularly. The patient could have an at-home blood pressure machine and send those results to the consulting healthcare provider. Other wearable technologies that are beginning to permeate the industry include heart rate monitors, sleep monitors, insulin monitors, and a number of other biofeedback devices. Treatment in remote settings follow reliable standard protocols based on evidence-based medicine. For in-person healthcare sessions, a physical examination or diagnostic test is often performed to correctly identify the issue and select treatment. More complex treatment options and immediate interventions may be available. While this process may be more sensitive to specific illnesses, it can also be much more time, labor, and cost-intensive. There are a number of different technologies that are being used in the provision of telehealth care services. The telephone is one of the first devices used to enhance patient access to care remotely. Telephones require little technological investment and can be used for a variety of things, including to make appointments, conduct brief patient interviews, and for pre-visit triaging. Next, we have messaging systems. Messaging systems can be used to replace non-urgent phone calls and visits. Messaging is considered an asynchronous service, where the client and provider are not engaged in real-time conversation. Instead, non-urgent messages are transmitted back and forth for information given. Synchronous services include those where the client and provider are communicating in real time. The most common type of synchronous communication is done through video conferencing using a secure internet access. A patient portal is a common tool recently developed as an asynchronous online platform where information can be stored and shared, including messages, healthcare records, test results, etc. Lastly, and perhaps the newest device to proliferate telehealth care, is the mobile app. Mobile apps can be used for synchronous or asynchronous communication, information sharing, symptom monitoring, and messaging. More and more telehealth care providers are using mobile technology because of the minimal investment for providers and clients and the ease of which it allows service provision. When we look at a brief history of telehealth, we can see that it began as early as the 1950s when the first recorded telehealth consultation was done over the phone, from Massachusetts General Hospital to Boston Logan Airport, where a patient was suffering from cardiac arrest. In 1965, just a few years later, NASA began using telehealth to remotely monitor and track astronauts' health while in space. In the 1970s and 80s, mobile healthcare units began to develop and serve rural communities, including on Indian reservations. Here, patients could utilize telephone and video services to communicate their symptoms to physicians practicing remotely. In response to the emergence of telehealth care, in 1993, the American Telemedicine Association was established, developing practice guidelines as a way to address quality of services. One of the largest contributing factors to the proliferation of telehealth care was the Department of Defense's decision to support telehealth care service provision. They saw telehealth as a way to reduce long wait times and increase health outcomes for veterans attempting to see healthcare providers. Over the next 20 years, organizations worldwide followed the Department of Defense's initiative. The Red Cross, for example, in 2010, began using telehealth to serve rural and hard-to-reach communities in underdeveloped countries. By 2012, it's estimated the telehealth industry is now worth more than $10 billion. As we can see, the use of telehealth care services has increased tremendously over the last 50 years, as new technologies are allowing individuals to access healthcare at rates never before seen. In considering the history and quickly growing utilization of telehealth care, the future looks very promising. More and more service providers are turning to telehealth as a way to serve clients who may not be able to access healthcare otherwise. With the continued development of more advanced technologies, it appears assessment and treatment options are only getting better.